Okay. You're welcome to Dr. Ephraim Madaguna YouTube channel. I am Dr. Ephraim Madaguna. I'm an optometrist, a low vision specialist, the medical director, Eye Afrique Vision Center, and the president, Eye Afrique Vision Foundation. In this channel, we'll be creating a lot of content that has to do with the eye. More of how to prevent some blinding problems that we see around us, blinding problems that are common with the eye. But I will start by answering some questions that I receive as a practitioner in my private clinic and in my clinic in FMC. Some patients always ask the doctor, "Doctor, is it not possible for me to use drugs to replace my glasses, that I don't want to wear glasses?" If you are interested in some content like this, or you want to know what the answer will be, I will advise you to draw closer and listen to what we are going to say. For the treatment of the eye, there are processes that the doctor needs to use to treat the eye very well. Number one, the doctor can use glasses, the doctor can use drugs, the doctor can use visual training, the doctor can equally use surgery. Some of these treatments are peculiar to the diagnosis of the doctor. For example, if your doctor recommends that you use glasses, you cannot use drugs to replace glasses. It's true, there are a lot of talk, a lot of teachings on the social media where they will tell you to do what? To use this supplement, use this, you will drop your glasses. I want to explain in details why some of those supplements cannot help you when there is a need for glasses. For example, let me start with a common problem that we see in the environment that has to do with glasses. Number one is called what? Myopia, or short-sightedness. When you are short-sighted, there is a need for glasses to correct that short-sightedness. The use of glasses cannot be replaced by supplements. If you are short-sighted, you need glasses to do what? To correct that abnormality. We call it ocular deviation. If you have an ocular deviation that needs glasses, you must use glasses to correct it. For example, short-sightedness. Let me explain what short-sightedness is. Then you will not answer if drugs will be able to correct that short-sightedness. Number one, if you are short-sighted, this is a human eye that has to do this, how the eye is in the eye. This is a dummy of the eye. When somebody is short-sighted, the image that is formed inside this retina will not fall on the retina direct, but it will fall what? In front of the retina. If the image is formed in front of the retina, you need a minus lens, which is what? A diverging lens, to help the image to form on the retina. So when you put a minus lens in front of the eye, it diverges the light for it to do what? To fall on the retina. That fellow or the patient will be able to now see clearly. That means the eyeball is longer than normal. So can you now tell me, is it possible for you now to take drugs that will reduce the size of the eyeball for the image to form on the retina? It's not true. So when you are short-sighted, the only thing that can help you to see is what we call glasses. Glasses will help you. Your spectacle prescription, just like the one I'm putting on, will help you to see better, not drugs. You can do what is called refractive surgery, where the cornea will be manipulated to reduce the refractive error. That one is different from taking drugs. Then, number two, when you are long-sighted, it means that the eyeball is small and the image is doing what? Is forming behind the retina. You need a plus lens, which is a converging lens, to bring the image on the retina. That is physics. There is no supplement you will take to make that eye to become big so that the image will form on the retina. It's not possible. So you need your glasses to do that. Then number three, if you have astigmatism, which is a refractive error that needs glasses for you to correct, it means that the cornea is not smooth and the lens is equally not smooth. When the cornea is not smooth, it forms more than one point image on the retina. When more than one point image is formed on the retina, there will be what we call confusion. That confusion will not allow the patient to see the image clearly. So you need an astigmatic lens to do what? To join the images together to collapse what we call the conoid of stone. When you collapse the conoidostome, the image will form what? On the retina so that the patient can see. So you need an astigmatic lens. So is it possible for you to take drugs that will make the cornea to become very smooth? No, you need glasses for you to do what? To see. Then the third condition that will make you use glasses is what we call presbyopia. Presbyopia is what? An aging process. When you are getting old, the crystalline lens that is inside the eye, like what is here, this crystalline lens become what? It becomes sclerosed. It becomes stronger. The ability of the lens now to focus images will drop when you are reading. The elasticity of the lens will reduce. When the elasticity of the lens reduces, you see the patient trying to shift the hand forward to do what? To read properly. Then when you bring your presbyopic lens, what happens? It brings the images on the retina. So you need a plus lens to correct presbyopia. So using presbyopic lens will do what? Will help you to see better. So there is no drug you will take to now to remove that glasses. You can take drug that can abate aging. Possible, it's possible. But when you have condition that need glasses to correct the eye, you must use glasses to correct it. The only case where you will see somebody that has refractive error after taking drugs, the person started seeing without the glasses, is in the case of diabetes. Because when you are diabetic, what happens? You have what is called diabetic ametropia. When there is diabetic ametropia, what happens is that you might use your glasses when the ametropia is there. Then when the sugar level drop, the refractive error somehow disappears. That does not mean that the refractive error that you have in the eye ab initio will not be there again. So diabetic patient, when their sugar is reduced, their vision becomes clearer. The ametropia is somehow altered. So there are drugs that they take. So if you give a diabetic patient a supplement that can reduce their sugar, it can make them drop their glasses. But when a child needs glasses, like a short-sighted child, and you refuse to give that child glasses, what will happen is that later in life, the child becomes amblyopic. Amblyopia means a lazy eye. A lazy eye is an eye that when you now put glasses, when the child now comes to term, or you, the parent, is ready now to give the child glasses, when the doctor now prescribe that glass, the glass will not be able to help the child again, because the retina where the image needs to be focused is now looking dormant. It's not active. We say it's amblyopic. So you will now need a lot of rehabilitation, orthoptics training to help that child to be able to see, to come out from that problem we call amblyopia. So glasses are important in correcting what we call myopia, in correcting what we call hyperopia, in correcting what we call astigmatism, and in correcting what we call presbyopia. The word correction is in quotes, because when I say presbyopia, when I say correct, you don't really remove it, because you can use the word ameliorate to alleviate, to help. Because once you remove that glasses, the child return back to the myopia. It's like wearing a high heel. When you drop the high heel, you return back to where you are. So glasses does not cause blindness. It does not make the eye to become big, or make the eye to be swollen, or make the eye look small, because it is something that you wear on top of the eye. So use of glasses in correcting refractive error is very important. So I would advise parents, when the doctor recommends glasses, that you should allow that child to use the glasses, because number one, if that child is not using that glasses, it will affect him in his academics. When the child is short-sighted, that means the child cannot see the board. Definitely the child will copy something that is not good. He will not read something that is not good. He will not read the writing that the teacher copied on the board. Definitely that child will not be doing well in school. Then the one that is long-sighted, he's seeing the board very well, but he cannot read for a long time. When he reads for some period of time, what will happen? He will want to close the book. So he will not be able to read for a longer time to assimilate more from the book. Definitely that child's academic performance will be affected too. The one that is astigmatic will always come with asthenopic symptoms. That's like headache, pain in the eye, tearing. Sometimes you see photophobia joining it. Photophobia means when there's light, bright light, the child wants to close the eye. The child will not want to use the phone when the light is bright. So those symptoms come with refractive error too. So use of glasses helps to alleviate a lot of problems. Like people that work in bank that have what we call computer vision syndrome. When you use your glasses, it helps to reduce computer vision syndrome. We are going to be discussing more things concerning the eye and how to keep your eye healthy, because the world is tilting into what? Preventive medicine. So if you are enjoy this video, I would like you to click on the subscribe button and equally give us a thumb up, so that other people then share, so that other people will get this information, so that we can debunk all the myths and legends that surround the use of glasses. More content will come your way. Thank you for listening.